Hi there, welcome to another episode of Time with Dr. Adams. Today we are here with obstetrics gynecologist Dr. Ainchi. We are going to discuss, a lot of people come to the hospital and say, oh, I want CS to be done with no specific reason. Well, people do have reasons, but tangible reasons. We want to know the pros and cons, SVD as the vaginal delivery versus Caesarean section. If you want to find out more, please stick around and do not forget to like, share, comment, and please subscribe. Time with Dr. Adams. Welcome. If today is your first time here, I'm really grateful. Do not forget to subscribe. So we are talking to Dr. Ainchi today about the pros and cons of vaginal delivery against Caesarean section. So welcome to Time with Dr. Adams.
Thank you very much, Dr. Adams.
Okay. So tell us the pros. What are the positives of having a vaginal delivery as against Caesarean section?
So, when we talk about Caesarean section, that is a surgical procedure that we usually employ to deliver babies, as against the spontaneous vaginal deliveries. So, Caesarean section has indications which can be absolute or relative. So, when we talk about indications, we can go into maternal indications, fetal indications, placental indications. So if there is a clear indication for Caesarean section, then we have to offer it to the woman. Now there's this phenomenon that is coming up, what we call maternal requests for Caesarean section, which is also on the rise, but we'll talk about that. So let's go straight to the maternal indications for Caesarean section. There are women that may develop certain conditions in pregnancy and therefore they may not be able to push. The first one is if the woman has what we call severe preeclampsia and the cervix is unfavorable. Let's say the woman develops hypertension in pregnancy with or without proteinuria and then edema. Very high BPs, so that it's not conducive for her to push. She's not in labor and the cervix is not open, so that one.
So it's safer for mother and baby.
Yes, we have to end the pregnancy because the BPs are high. We normally go for cesarean sections. Others like fibroids in pregnancy, which is a low segment fibroids in pregnancy. It means that the fibroid is going to obstruct the passage of the baby out.
So what you are saying is it depends on where the fibroid, because I have fibroids,
yes.
But I was able to.
It depends on where the fibroids are. If they are low in the lower segments, it means that the baby cannot come out. Okay. Then there are a lot of them, maternal causes. Some of them may not be absolute, but relative. For example, if somebody has had one previous cesarean section and they come with a big baby, that one becomes both maternal and fetal, because you have a previous cesarean section and a big baby.
But the previous section, is it always that because I've had one, I should have my other children should be cesarean?
There should be another indication, as I said, for previous cesarean section. The cutoff for a fetal weight, estimated fetal weight is 3.5.
Okay.
So if you do a scan and then it's telling you that the baby's weight is 3.5 or more, then it means that it's not advisable to push. You may end up rupturing the uterus because there's a previous scar.
Okay.
All right. Now let's quickly go to the fetal causes. The fetal cause, the patient may be in labor and then the fetus will develop fetal distress. There may be malpositioning, what we call malpositioning. You can have hospital posterior position, direct hospital posterior, hospital transverse positions.
So not to confuse my people, the baby is not lying well.
Fantastic. The head, the position of the head may not be in a good position to push vaginally. Okay. Then we can have malpresentations. For instance, somebody comes with breech.
Means the baby's leg or buttocks is
coming down. The baby is coming with the buttock or the feet. So usually, especially if that is the first or second pregnancy, or the person has not had a previous breech delivery, then it's advisable that you go and do cesarean section. Let me quickly go to the placenta. You can have what you call placenta previa. This means that the placenta is at the lower part of the uterus. I don't want to be too technical, so let's end it. So the placenta, instead of being up, so that the baby's head can come down, or if it's the bottom can come down. The placenta is at the lower part of the uterus. So we call that one placenta previa.
Which is dangerous to both mother and baby.
Exactly, because where the baby is supposed to come to, that is where the placenta is inserted.
Okay.
Then placenta abruption, which is also relative, it's not absolute in case, because if you have placenta abruption with favorable cervix, if the woman has dilated, maybe the abruption occurred during rupture of membranes, and then the woman is already in labor, anything after 6 years, you can just augment labor, the patient will push. But some of them are so bad that, and we have grades, especially the type 3, grade 3A, the share statement classification 3A, where the patient is bleeding with or without coagulopathy. So that one, you want to quickly remove the baby, especially when the baby is alive. Because with grade 3, there's abruption with a live fetus. With or without coagulopathy.
So now we've spoken about the indications, maternal indications, and then the fetal indications as well. Now my question is, can mothers just walk in and request for CS? Okay, let me ask this first. As a specialist, would you advise your patients, a mother who has no issues? When I say issues, there's no indication, maternal indication or fetal indication, to go through CS?
Yes, it's a phenomenon that is coming up, what we call maternal request. Patient coming with no absolute indication, no relative indication for cesarean section, and wants cesarean section. We do offer them, especially in the private hospital, but in the government hospital, because national health insurance doesn't cover, if the person wants to pay fully for the service, we do offer it. Okay. It's the patient's right to ask for cesarean section.
Because I'm a doctor.
As a healthcare practitioner, you have a responsibility to counsel them.
Okay.
Tell them that you can push. There is no indication for the cesarean section. You can push because vaginal delivery, natural things are always the best.
Safer.
No, natural things are the best. But currently, cesarean section is safer.
Okay.
Because we have control over whatever is going on. Exactly.
Okay.
But spontaneous vaginal delivery, which is natural, is the best.
Okay.
So you have to counsel the woman that whatever it is, this one you can push. But if she insists on cesarean section, you still have to counsel her and do it for her.
I've had people contacting me and telling me their doctors actually force them, even though they say they want CS. The doctors will say, I'll go push it.
No, you have to counsel her, let her know the pros and cons of cesarean delivery, of course. Once you are going to cut somebody, it means that there will be some blood loss.
Yeah.
Of course, even vaginal delivery, there may still be blood loss, what we call postpartum hemorrhage. It can happen with any of them, but for cesarean section, you have control, especially if you are an experienced doctor, be it a medical officer or a specialist who has good technique in cesarean section, patient is safe. All right. So I would say for maternal request, once the patient comes in that I want maternal request, you can counsel her. Some of them will change their mind. Others will say, doctor, I want cesarean delivery, and you have to offer it because it's their right.
So what are some of the main negatives about cesarean section?
For every surgical procedure, there is the likelihood that you may develop some complications. Bleeding, there are infections, injury to other structures around, like the bowel, the bladder. So these are things you should, as part of your counseling, you should tell them that it's better to push if there are no contraindications towards vaginal delivery. You have to push, and unless there is a contraindication to the vaginal delivery.
So before we let Dr. Entry go, last question. There's this guy who told me that instead of he allows his wife to go through SVD, the wife's vaginal say, "Oh, can you treat him? What's an baby?" Yes. And on your CS, I never want to.
Yes, I would say it's true to some extent. Of course, once you are using the place, obviously it will not be like somebody who has never pushed.
Okay.
Definitely, the size of the vagina may increase a little. But
of course, we say that the vagina is elastic.
Yes, but definitely it's not be like somebody who has never used the vagina for delivery.
Okay.
There will be some slight changes in terms of size, but it's not so significant.
So it shouldn't be
yes, it's not so significant. So people should not use that as an excuse. And of course, once you are doing cesarean section, I mean, back to the other question, you should know that you are limiting the number of children you may probably want to get.
Okay.
Because usually, the maximum is about 3 deliveries.
Okay.
So you do 2 previous years, then you do a 3rd one. We tell you it's okay, because usually wherever we are cutting, the same place we cut, and then once we are cutting, every incision makes it a potential weakness in a way. So that is why once you do one cesarean section, your next delivery, you have 50% chance that you may deliver vaginally, or 50% chance that you do a repeat cesarean section, because already there is a scar, and therefore you have to follow or fall in a criteria. Baby should not be more than 3.5 kilos. The baby's position and everything should be longitudinal lie. You see, there are a lot of things. The lichen around the baby should be adequate. You know, the placenta position, because mind you, cesarean section also increases your risk of developing placenta previa, because it's a scarred uterus. So they are all good if the indications are there. People still in Ghana think that cesarean delivery is devilish.
Yeah.
Yes.
Yeah.
People even think that if you tell people I'm going to do cesarean section for you, they think that, hey, this one is Obonsame Juma.
And their pastors actually telling them,
yes,
what to say Hebrew woman in yes.
So it's all about, for obstetrics and gynecology, it's all about counseling the woman. Make sure you do adequate counseling. But that is where the woman will make an informed decision. Offer it to them and let her choose. If she still insists, document that you did this counseling and the woman insists on having what? Cesarean section, although there was no contraindication for vaginal delivery. I have had I want to share this with viewers and subscribers. I had a very bad family issue concerning my own cousin, who, I don't want to mention the name of the hospital, who had 3 children, so she was going for number 4. All the 3 children were by vaginal delivery. So she approached me that, brother, I'm going for delivery. I wanted to do cesarean section so that the doctor will tie my tubes. I don't want any more. So I told her that it's not done that way unless there's an indication for the surgery, so that we can also do the BTL. For the bilateral tubal ligation, for the sake of viewers, that is what normally call sterilization. So if the woman decides that I don't need any more children,
so we cut the tubes and
tie the tubes and then cut. So she wanted that, and that could be done immediately after vaginal delivery. You can do it immediately within 24 hours. The uterus is still out there. You just cut below the umbilical. You get the tube, so you tie. You don't need to do cesarean section and do BTL.
Okay.
So I told her this was around February, and she was supposed to deliver in April. So I explained. I mean, it was even after a family gathering, you know, in their house. You know, she's a cousin, so. After the gathering, I hung around, so I spoke with her and all that. So I didn't hear from her again. And then the next time I heard she had done cesarean section, she went for the maternal request plus BTL, and unfortunately had postpartum hemorrhage and died. Yes, my own. In fact, she's actually the finest cousin I've ever had. She likes me so much. And for this calamity to happen to the family is something I will never forget, because if she had listened to me that you can deliver after that, you do your bilateral tubal ligation, I'm sure my sister would have been alive. But she opted for cesarean section. Of course, I'm sure there was some counseling that went in there between her and her doctor, because all the 3 previous deliveries were with the same doctor.
Oh, okay.
Yes. Okay. So she has a lot of faith in the doctor, you know, and this unfortunate thing happened. It's something that I always get sad about. So I don't normally advise people to go for this maternal request. You have to counsel the woman very well and offer it if she wants it.
All right. So, conclusion, what I've learned from this interview, that whatever it is, whatever choice you want to make sure you understand the pros and cons of your choice, whether by SVD or by cesarean section. Talk to your doctor and make an informed decision. Thank you very much, Dr. Thank you for coming to Time with Dr. Adams.
Thank you.
If you have any more questions, please let us know in the comment section below. Do not forget to like, share, and please subscribe. Bye.